nationwide manhunt for a COVID denier and conspiracy theorist who police believe is a danger to public health.
Well, Toby Hayden Lee is wanted by police in connection to an incident at Surrey Hospital where he allegedly entered a COVID ward without a mask and attempted to remove an elderly COVID patient.
Well, NHS doctors and nurses are alarmed about the growing risk of COVID conspiracy theorists entering hospitals, and a video of the incident has since been posted on social media. Well, that video, which was filmed at East Surrey Hospital, has been viewed thousands of times, and the incident is now being investigated by the police.
Well, we're joined now by Dr Ranj and Dr Samantha Batt-Rawden, who is an intensive care doctor, to discuss this further. And Samantha, I wanted to start with you because for us, you know, with our untrained eyes, we look at that and that is shocking. But for you, as somebody that has worked within intensive care and deals with this in a day in, day out, how did you feel when you saw that?
Just gobsmacked. Completely gobsmacked. This is an acute respiratory ward full of patients who are incredibly sick, some of whom will be dying with COVID. And our wards are closed for a very good reason, and it's to keep people safe and to stop this horrible, horrible virus from spreading. And nothing, I mean nothing, gives you the right to break into a ward and abuse NHS staff, even less so if you're not wearing a mask. They put themselves at risk. They put the staff at risk, and ultimately what we really care about as doctors, they put the patients at risk.
Well, we don't know the relationship with him and the patient, and the patient did actually sound as if he was agreeing with the fact that, that he wasn't happy with his treatment. So we'll stick with you, Samantha. The treatment of COVID-19 in hospitals, better for us all to go home and take vitamins than to have the medication that's prescribed for us in an ICU unit?
Please don't. They are not proven treatments for coronavirus. Proven treatments for coronavirus are oxygen, ventilatory support, antibiotics if you have a bacterial infection, and steroids. All of those things we can give you as your doctors in hospital and can't be provided for you at home. So please don't listen to the misinformation on social media. We're here to look after you and to do the best for you.
Dr Ranj, you look at that and you think, God, you just can't believe what some people will do to go into a hospital and behave like that. And you could focus on that bit, which, of course, we must today. But also it's important to focus on the doctor there who was so calm and in control. And that was, I mean, that was extraordinary, really.
Yeah, it's admirable that he was able to keep his cool, I think. It's really hard as a medical professional to limit your emotions when you're in a situation like that, but you have to be professional. What we must remember is that most people do not actually mean other people harm. This is a family that is concerned about their relative, and they are doing what they think is best, and you have to try and understand where they're coming from. However, the basis on what they're thinking they are doing their best is completely inaccurate. It's actually dangerous, and just as Samantha pointed out, these are not proven treatments that they were reeling off. These are treatments that have been thrown around on social media as fake news, and people think that fake news is harmless and doesn't do anything. Actually, it does, and this just goes to show how dangerous it can be.
And so can you explain one of the things that was said in that video, and that's the discussion about the virus being declassified?
Yeah, so that is basically a technicality. A high consequence infectious disease is classified according to certain criteria. There's 6 things. It's got to be an acute infectious disease. It's got to have a typically high case fatality rate. We don't have effective prophylaxis or treatment, often difficult to diagnose or detect, can spread quickly in the community and healthcare settings, and requires a certain enhanced level of treatment. When something is classified in that category, it just means that we put in certain measures to control it and manage it until we know more or until we are better treating it. When something is declassified, that doesn't make it any less serious. It just means that we don't need those specific measures put in place. Flu, which kills thousands of people every year and we take as a serious illness, is not on that list. That does not mean it isn't serious. And this is the problem when people have a little bit of information but don't understand the totality of information. And that's what fake news does. It implants lies in between two truths, so it makes it look true. And unfortunately, many of us who don't have necessarily the scientific background or the knowledge or time to go out there and research everything may not realise that what we're being told isn't the entire truth.
But you would think also that senior Conservative MPs wouldn't necessarily be following what appears to be the track that you've just described. So Desmond Swayne has urged anti-vaccination campaigners to keep going with their fight against government restrictions and told them that the NHS capacity figures were being manipulated to exaggerate the scale of coronavirus. Now, Michael Gove has since called for him to apologise, but Samantha, there you go. So that's a senior Tory MP who's saying that the figures are being manipulated to exaggerate the scale of coronavirus.
I just can't even. You know, when you're a member of the NHS and you're giving your all and spending 16 hours in PPE and working 7 days a week, you know, working yourself into the ground to keep patients safe, to hear that from somebody representing the government is just, you know, it's really, really upsetting, and it's not acceptable. You know, the pictures that you see of ambulances queues down the road, they are real. And they have sick patients inside because we do not have enough beds to get patients out of ambulances and into A&E. And we can't do that because we don't have enough beds in intensive care to get patients out of A&E who are ventilated in intensive care. This is very, very real, and we're living and breathing it every day. And if a Tory MP wants to see that, they're very welcome to volunteer in my ICU, where we are short-staffed, to help us turn patients onto their front so that they can fight for their lives.
Dr Ranj, you know, the morale of those on the front line at the moment within the NHS is so, so important. What does this do to them when they see that people are believing these conspiracy theories and that this fake news is seeping through?
You know what, as healthcare professionals, we understand where people's concern is coming from, and they are just trying to make sense of this horribly chaotic world around us. And that's why conspiracy theories, I think, catch on. What's really, I suppose, disheartening for healthcare staff is that we are trying our best to do the best by our patients, to try and keep everybody safe. We have no reason, as I said the other day, to lie to anybody. And what we're seeing now, having come out of the first wave of coronavirus and being caught up right in the peak of the second, is that people are exhausted. They're getting, we've got staff members whose mental health is now suffering. People are showing signs of PTSD. We're going to have a massive fallout after this in terms of healthcare staff and how they've been affected, as well as everybody else. And I think people forget sometimes we also have to care for our carers. And the best way we can all do that at the moment is to listen to them and to follow the guidance.
And Samantha, you know, if there was, in the beginning of the first lockdown, we clapped the NHS. We were all behind you as a nation. It seems that this bizarre fracturing has now taken place. Still the NHS are there for us. Still they work for us. Still you hear the calmness of that doctor attempting to save that man's life. We hear the passion in your voice. And if you don't have an NHS, then look to Brazil. Family members are having to care for their relatives with a lack of oxygen in the corridors of overwhelmed hospitals in Manaus, in Brazil. For those patients who don't survive, there is no funeral service. They're placed in the city's graveyard without a proper send-off. Hundreds of freshly dug holes have been filled already this year. 9 million cases of COVID with over 200,000 deaths. Some evangelists have been reported from America who deny the existence of COVID and then have died from the disease. And so when you look at those pictures from Brazil, Samantha, you know, once again, we bow down to you guys at the NHS and all that you're doing for us. And again, have to, because you've had your own abuse, haven't you? People have abused you.
Yes, I've been lucky that I haven't had it in person. A lot of my colleagues have. Unfortunately, I have had that on social media, and that's everything from people saying, well, I don't care who I murder by not wearing a mask. You know, you can't tell me what to do, to yesterday what was going around was calling ICU doctors ventilator killers. But I think we have to remember that this is a very small minority. They're a vocal minority, but you know, we are very overwhelmed with the majority of the public who have shown us support at this really difficult time. So we do really appreciate everyone that's doing that and who's staying at home for us.
Well, you have the weight of our support behind you. You really do. Thank you for taking the time and talking to us about this. And Ranj, as always, thank you.